Good morning, everyone. My name is Dr. Jonathan Barr, and I'm an EMS fellow at Cooper University Hospital. Today I'll be presenting the study assessing the impact of COVID-19 on EMS workers in southern New Jersey. As all of you are well aware, COVID-19 has placed an incredible amount of stress on our healthcare workers. Previous studies have demonstrated that in prior epidemics, this has led to PTSD-like symptoms and other mental health problems in healthcare workers, and even early data from China in the COVID-19 pandemic demonstrated increased prevalence of symptoms of mental illness such as depression, anxiety, insomnia, and acute stress syndrome. However, EMS workers were largely neglected from these studies, despite the fact that the baseline rate of mental health problems, including PTSD, is already high in EMS workers. One meta-analysis estimated the occupational rate of PTSD in EMS workers to be around 11%. Our study used a survey instrument using selected items from the Heroes of Health Initiative PCL-5 to evaluate for the presence of PTSD symptoms in EMS workers in southern New Jersey. We considered a PCL-5 score of greater than 6 to constitute the presence of significant PTSD symptoms. You can see our results in the middle of the poster as well as in the right-hand column. We received a total of 72 electronic survey submissions, of which 70 were analyzed as 2 were submitted blank. You can see that there was an even distribution across age, but the majority of participants were young, between 18 and 34. We also had about an even split between EMTs and paramedics who took the survey. Interestingly, about 24.2% of the population demonstrated PTSD symptoms. Of those, 76.5% were paramedics. Otherwise, we did not find any significant differences across age, gender, employment status, or risk factors. Most of the participants cited the highest stressors as contracting or spreading COVID. Many also reported thoughts of trouble sleeping, as well as thoughts of quitting their job. To sum it up, compared to a previous meta-analysis in 2018 that placed the prevalence of PTSD in EMS workers at around 11%, this study suggests that the COVID pandemic may have significantly increased those numbers, as our PTSD prevalence of symptoms in this study was 24.2%. While the prevalence rose equally across gender, age, and employment status, it seems that in our study, paramedics were more vulnerable. We can only speculate as to the cause of this. It may be related to the increased acuity or intensity of the cases that paramedics have seen, or possibly related to the increased education and increased understanding of pathophysiology that the paramedics have compared to EMTs. Future studies might help elucidate why the paramedics seem to have a higher prevalence of symptoms compared to the EMTs. In either of the cases, I think that one of the things that our study highlights as being very important is that our EMS workers are going to need additional support and additional help to combat these PTSD-like symptoms in the setting of this COVID pandemic, and will need additional support as this pandemic continues to go on and on. Thank you for listening in, and we'll be happy to answer any questions.